everyone. Welcome to Misconceptions. We are in for a fascinating conversation. I know it because we are going to be talking about nutrition and pregnancy and postpartum and a little bit more about some of I think what I really want to hear about is all the things that we're sold like a bill of goods about around nutrition and how we can maybe better understand the impact of nutrition on the pregnant person, but also maybe some of the sociocultural messaging around nutrition. So I have with us today somebody I've actually only met just a few moments ago, but referred so highly from our community and network of professionals. Eling, welcome. Thank you so much for saying yes.
Thank you for having me, Dvora. Yeah, and I'm so happy to be here to talk about this topic I'm really passionate about.
Excellent. So tell me a little bit about yourself professionally. Do you live? What do you do? Tell us about your background.
Great. Yes, so my name is Eling. I'm a registered dietitian. I'm based in Brooklyn, New York. I've been in this area for almost 15 years. And professionally, I work as a dietitian in eating disorder treatment on an outpatient level. So I'm working in private practice with people who are struggling in their relationship with food, whether it's anywhere along the spectrum of recovering from chronic dieting or experiencing disordered eating to having a diagnosed eating disorder. And then, I'm also a certified diabetes care and education specialist. So I really enjoy working with people who are wanting to learn about managing their diabetes, but from a weight inclusive lens, ED informed lens, and as it relates to our conversation today, working with women who've been diagnosed with gestational diabetes.
Very, very interesting. So, we're looking at, I think one of the things I would love for you to, first of all, with a passion, where did this passion come from for you? I feel like some people who go into the eating disorders world maybe have family or friends that were deeply impacted by it. What was your passion? What was the prompt to your passion?
Yeah. Thanks for asking that question. I actually, started off as a public health person. I was working in public health and really got very interested in nutrition in general, on a community level. So I decided to go back to school to become a dietitian. I had no idea about the world of eating disorders. I really couldn't have imagined this is where I would find my niche and my real passion in the work. But I met the right people along the way. I was, in my training. I was connected with Lindsay Krasna, actually, the dietitian I work with for now at LK Nutrition. And she just introduced me to the world of nutrition care for people who are having a complicated time with eating, and particularly thinking about food from not a weight loss perspective, which is so often how food is talked about. And it just really blew my mind. And I related because I'm a person living amongst diet culture as we all are, and I could really understand the harms that were being done, not by mainstream media at large, but also from the nutrition community, how
Yeah.
much harm can be done, just like with really black and white messaging, really exclusionary sort of nutrition education. So that's kind of how I developed this real interest in working with people from a weight inclusive lens, health at every size informed lens, um, and eventually, specializing in eating disorders.
So when you talk about a complicated relationship with food, I want to tear that up with you a bit because I think that some people maybe would not rise to the level of being diagnosed with a formal eating disorder, but have a complicated relationship with food. I would even suggest that sometimes where there's kind of historical trauma, like within the cultures in which you're serving, that where food holds tremendous maybe reverence, but also relevance to the traumatic experience. I will share with you that I remember hearing a story. Oh, I must have been probably like 19 or 20 years old. And I had just met a Holocaust survivor who told us a story where she was actually on a hijacked plane and the plane comes to the ground and Red Cross was allowed to get in Red Cross was allowed to send in food. And so the meal comes in and she described it as like the little boxes of raisins and some apples and people were like, no, I don't want to eat that. And she went around, she was able to like gather up the other people's foods. She's like, there's no guarantee Red Cross is giving us food tomorrow. She knew culture, from her personal traumatic Holocaust survivor history, that food was not guaranteed. And therefore the relationship that she understood the impact of the food for the now and into the future. And I think that what we know is that that's transgenerational and, that inherited trauma is there. So let's talk a little bit. Thank you for letting me share that story because it's always like her name was Miriam, by the way, and just remembering that story of how wise she was in her distress. And by the way, she was right. The Red Cross were not allowed to bring in more food. So thinking about complicated relationships with food. Let's define what that looks like when it's not diagnostic. Maybe it's cultural. What are we thinking about?
Yeah, yeah. Thanks so much for sharing that. And it is you're right. So many more people really struggle with what we may call like subclinical eating disorders or subclinical disorder eating, where there's no criteria, there's no diagnosis, but there's still so much distress and preoccupation and overwhelm. And I think that's actually a really vulnerable population because ultimately in today's culture, those feelings around food are very normalized. So it's like, oh, isn't everyone preoccupied with food all the time? Shouldn't that just be that's how we all live? When really I want to name that any amount of overwhelm or anxiety about food is worth attention and support because you don't
Mm,
have to live with it. Um, but I would say I define it as any amount of um, yeah, a preoccupation is the word that comes to mind. It's just really being fixated on making on food decisions and feeling a lot of guilt and shame around food choices, kind of feeling a lot of worry. What will the outcome be if I eat this food? A lot of that may be tied to body image, but it also may be tied to health anxiety in general. Um, so so just anytime someone is feeling a lot of worry and feeling like they can't make the right decision, I think that is just the crux of like what a complicated relationship with food is like. Very little trust in one's own body cues. So little trust if they feel hunger, should they eat or should they not? A lot of people actually feel safer not eating when they're hungry. They think that's the right thing to do. Shouldn't it lead to a thinner body? Isn't that what we all want? So that type of thinking, I would say, is really prevalent in a complicated relationship with food.
Okay, so I've got to ask you this. What
Yeah.
percentage of the population have a complicated relationship with food? Because I'm thinking to myself, like you said, isn't that how everybody imagines? Isn't that how everybody experiences food in general? I feel like it's like the most talked about conversation among young girls, young women, postpartum women. It's what we talk about. I can't lose weight. I want to lose weight. Where, what percentage of the population doesn't experience that anxiety and preoccupation with food or eating?
Yeah, the number is hard to pin down. About 10% of the US population will experience an eating disorder in their lifetime. That's already fairly high, in
That's
my opinion.
huge.
Yeah, right?
Ah,
So to imagine how common subclinical sort of disordered eating is, I think I've read numbers that it's like, over half the population because
okay.
especially like you named sort of the generation how generational trauma gets passed down, particularly with food. We eat in our family's home, we learn how to eat there, and then we become adults who sort of mirror our family unit in a lot of ways. So it's a cycle that can kind of like exponentially grow if we
Yeah.
don't address it.
Can I ask you, are you familiar with other cultures that experience food in a similar way? I mean, I'm most familiar with the Jewish culture, but I have no doubt that other communities of culture experience it similarly.
Yes, oh yes, definitely. And I think even just speaking from my own culture, being Asian American, my family is from Taiwan. I'm the first person in my family born in the US. Seeing the way food is definitely it's a form of love. It's abundant within the home. It particularly women are very responsible for feeding the whole family, and yet culturally comments about body are also very, very normalized.
Mm,
They're a way of showing like, hey, I notice you. Hey, I've noticed you've changed, or I see you. But from a Western lens, for how I grew up, it's really complicated to hear someone say, "Oh, your body's changed." It's not, and so I think it has
interesting.
created a really tough dynamic for people who are maybe living in dual culture kind of communities, both Eastern and Western, just speaking just from my experience. But yeah, many cultures use food as a form of love. And then I think at the same time, the behaviors around the food are not so regulated. I hear all the time from clients, mom will cook all this food, but then won't eat it herself. So
Right.
those things can definitely pop up.
Right. It's fascinating. It's really, it's also fascinating. Sometimes you see in other cultures. I lived for a number of years around a strong Bukharian culture, and the women of the Bukharian culture, like, first of all, there was no such thing as freezing food. Everything was made fresh every day. But there was also, I remember as they prepared, for example, for Passover, they would often get together in groups and cook together. There was a shared experience of cooking or preparing the food, but it also was an extreme amount of responsibility, like a daily, hourly based responsibility. So it's always something for those of you who are listening, just kind of thinking about like what are the cultural or really deep cultural messages that perhaps we grew up with without even realizing it was a message. I think that's always something quite fascinating to consider. Yeah.
Totally. Yeah. And I think people who want to honor their heritage and honor their culture, but also noticing like where harm was done, it can be really tough to acknowledge like, hey, this culture that I appreciate and want to um, celebrate also has some harmful elements. Like that can be really tough to hold. So,
Absolutely.
yeah, thanks for bringing that up.
Absolutely. So let's discuss a little bit about before we get into perinatal and the postpartum space, but what are some of right now, I mean, there's two things I think we have to talk about. We have to talk about the sociocultural messaging that exists, which I think is almost like yeah, of course, like we know this, we're hearing it. I think anybody who's attuned to the world, and especially the world of women in particular, but not disregarding the impact on men as well. It's a little bit different. But those of us that are attuned to the female experience in the world, will acknowledge that the sociocultural messaging is really, really messy, really messy. The other thing that we have to talk about is the influx of, the GPL, right? GLP-1s, the GLP-1, thank you, the GLP-1s, the Ozempics, the Wegovy's, the Mounjaros, like all these medications that are being, kind of thrown out there. And I think we'll talk about it. I hope to have somebody on who will talk about it more directly, but I think that does lend itself to the conversation with culture with like the sociocultural messaging. What's your perspective from a nutrition and, dietitian's perspective? What are the messages, and where are we maybe even not noticing the messages that we are hearing?
Yeah, yeah. The messages are overwhelming that thin is better. Like everyone should be striving to live in a thin body. And that comes from, I think, both the medical community, as well as sort of the mainstream, just who gets put on TV, who do we see as beautiful, who is named as attractive. This harmful idea that only people in thin bodies are worth success or worth romance or things like that can really trickle down and start impacting people at a very, very young age. Um, and so I think that's the overwhelming message. And I think secondary to that is at all costs, then at all costs. So then it becomes sort of, hey, it's on you to make this a reality for yourself. At what lengths will you go to make sure you remain in a thin body or that you that you can attain a thin body. And so that is where I think all of these disordered behaviors and sort of cognitive distortions come into play. And then they become quite normalized because we're all in the soup together, so,
Yeah.
kind of wanting to encourage each other to uphold the thin ideal while also seeing personally that it's so harmful. So I think that's like, the messaging I'm hearing from my clients that I have heard myself. And it can be really disguised. I think that's this kind of the scary part is that it can be disguised under making healthy choices for yourself. Don't that's where healthism comes into play. Like so
What
I
is that
think
word you just used? Healthisms?
healthism that's also like health at every cost. So it
Hmm.
becomes not just thin at every cost, uh but thin is healthy. So it becomes moralizing, like we should all be pursuing health and
Hmm.
but again using really harmful methods to achieve this quote unquote health. When really the health is just thin, if that makes sense.
Yeah, I
Yeah.
think it makes a lot of sense. I think that healthism, I like that word. I think thinking
Yeah.
about, and then on the other hand, I'm listening to you thinking, yeah, but there's truth in that, right? That the larger the body, the more health risks that likely will be associated with being obese. Let's not just say, again, I agree with you that I'm not in disagreement, but we have this range between ridiculously thin. I find it astounding to see some women who look like they're prepubescent and they're in their 40s. But then we have the extreme or like, I guess the middle is where we're all targeting. But somewhere in that line, it goes from middle to extreme where obesity becomes a health risk or that there are health risks associated with obesity. And I think the challenge we have is also defining obesity. Like, what is the number that I'm given as obesity is going to be, primarily the BMI is going to define what is considered healthy or not healthy, what is going to consider having health risks or not having health risks. Also, what's going to consider my life insurance policy, right? Whether
Mhm.
my what my health insurance rate, life insurance rates are going to be. A lot of that is tied into it. So, I think as a consumer, as an informed consumer, I find it very complicated to figure out what is healthy versus what is what is obese, what is healthy, what there's so many different messages. I hope I'm making sense.
Of course, yeah. And I think actually, I think it's designed to be really confusing because it keeps us all invested in diet culture.
Mm,
And I'm happy to speak to this because I've done a lot of research myself, and I think the weight inclusive arm of dietetics is really passionate about just challenging the messaging that people often hear, which is that if you keep gaining weight, your health is at you're destined to have health problems or health concerns, or hey, you have this diagnosis because of your weight. That's also another way it gets reinforced in the medical community. When really we also want to acknowledge the extreme health risk of weight stigma, which is the experience of going to the doctor and having your
mm.
pain disregarded or your health history disregarded and just being told to lose weight rather than being given a medication or an intervention that could actually help. Um, and so we really want to name sort of how harmful weight stigma is and all the negative health outcomes of experiencing weight stigma
That's
as
really
well.
interesting. Wait, give me 1 second because I have to underline that for a minute. That there is because okay, what you're saying is that there is risk, emotional risk or health risk associated with being disregarded or disrespected or not being honored in how difficult the experience is for somebody who is at a higher weight and maybe even trying to lose weight, but like acknowledging that this is a challenge for you and just being told just lose weight or not being respected in how difficult that experience to be living in that body actually is.
Exactly. Yeah. Yeah. And there's research done on truly the negative health outcomes that occur based on one's experience with weight stigma. And I think one of the worst things that can happen is someone can disengage with the healthcare system. And I think as a weight inclusive dietitian, I've met with many people who I think are pretty much at their wits' end with the healthcare system and are shocked to find out that there are healthcare professionals who want to help them solve sort of their health concerns without talking about their weight at all. Because
Yeah.
almost all of these acute and chronic conditions that we mostly are thinking about, whether that's high cholesterol or blood pressure um, or diabetes or joint pain, things like this, can be targeted and discussed without actually thinking about specifically a person's weight. What we try to focus on is the behavior. So, what are the health promoting behaviors that people feel empowered to implement in their life? And how would that make them feel? If we stick too closely to what number on the scale does that produce, I think we're distracting people actually away from their initial complaint. So
Hmm.
I totally get why it feels so confusing. Like, hey, what is a healthy weight and what isn't? And I'm more interested in what are the behaviors that make people feel really good, regardless of whatever weight they end up at when
Wh-
they engage in those.
And what are some, like, give me some examples, meaning like
Yeah.
when, because I think some of the challenges would be like, yeah, I'd love to be able to do an hour of aerobics, but my knees hurt or my ankles hurt or I don't have the strength or like, so ideally I imagine, I personally have always been like, I'm an athlete. Well, not on, I don't even know what that really means, but like, I'd love to be an athlete, right? I'd love to be, but I also would acknowledge that being in a size body that maybe might prevent me from being a runner or something like that. So how do you like like wrap your head around there are limitations when a body is at a specific size that might come in conflict with, as you said, these health promoting behaviors?
hmm Yeah, I think that's a common way of sort of approaching it, which is like, well, I, yeah, I like this question because I think it forces us to be more expansive about how we think about goals and sort of how we get there. The way I would approach it is let's let's look at what you can do right now. So I
Hmm.
think oftentimes, dietitians, we do a lot of goal setting. And oftentimes we're sort of looking at a goal that is can't wait to get there. Like super excited. Love that there's a long-term vision. But let's just focus on you and your body right now, right? So much rather than viewing one's own body, whatever size it may be, as like a barrier or a place of shame or something that has to be changed right away. Let's again focus on what can you do right now? If your long-term goal is to run a 5K, what is something you feel ready to do today with your body today? That can empower you to keep moving toward
Hmm.
a goal.
Hmm.
And again, I think it's so important to say that that is a that becoming an athlete, that could be, so many barriers can come in the way that are irrelevant to body size. So people in thin bodies and people in larger bodies both may struggle with the same barriers of running a 5K.
True.
So just to kind of keep bringing it back to that message of, hey, um, let's not talk about weight as if it's uh yeah, there's just I think there's an overemphasis on it at times that can just cloud one's experience with their body.
Mm,
Um
interesting.
so yeah, I hope that
Interesting. Yeah.
answered your question a little bit.
So tell me a little bit about I mean, I'm quite familiar with the GLP-1s,
Yeah.
and I'm wondering how you feel these have been helpful or harmful to kind of these messages that we're getting about weight and and weight experiences, right? Because on one hand, I think that for many of us who have dealt with weight issues for many, many years, it's almost like we're finally feeling a little bit acknowledged of like, yeah, there's a medical issue. But it does feel like it's feeding into the diet culture, into the thinness culture, into the thinness that is ideal. How are you navigating that?
Yeah, it's such a nuanced, complicated topic because it's also so new. I think even to the healthcare community, like we're all still learning just exactly who the best candidates are for these medications. And coming from the eating disorder treatment space, I think I'm probably um, maybe more, maybe just thinking about it, elements of the GLP-1 more than other types of communities. So, I think depending on who you ask, there's going to be lots of different types of responses. Um, I think, as from a diabetes educator perspective, amazing for blood sugar management. I have worked with people who just have had such great results after years of having difficulty managing their diabetes to living. A lifestyle they didn't know was possible, where their blood sugar was really managed and they felt really good in their bodies because
Hmm.
of that. Um, but yes, I think once we began to introduce the drug as also kind of the offshoots that target just weight loss, I do think that's where that socio-cultural messaging got really loud.
Hmm.
Well, then because there's an option available, shouldn't everyone be on it? Again, back to that sort of thin at all costs, health at all
Hmm.
costs.
Hmm.
Um, and so I think it's created really complicated feelings for people who have been working hard to embrace their body or to, again, work on health promoting behaviors without tying it to a number on the scale.
Hmm.
Uh, so it's certainly really nuanced. And I think it has to be a case by case basis in terms of if it's a good fit for someone.
Yeah. Yeah, I just think about it like if the mass population are seeing this, the mass population of like the nutrition professionals who outside of diabetes are seeing this as like this is great because it's going to help so many people, or like we're really feeding the same culture just in a different way. It does make me wonder.
Yeah. And I think when I'm sitting with, my clients who are struggling with disordered eating or eating disorders, um, it the general tone is like this is reinforcing all of my greatest fears, that
Exactly.
I'm not allowed to be in the body that my body I'm not allowed to be at the shape and size that my body wants to be at. So many people, body size diversity exists, right? It is clear as day that some people are in smaller bodies and some people are larger bodies by no manipulation of their own. It's just the way their body is. And so I think if we aren't careful with the messaging around GLP-1, it can really, really become a harmful element,
Oh yeah.
harmful
Oh yeah.
intervention.
I do miss the 1800s where everything large was normalized. It's like this is great. She's got meat on her bones, like there was something to be said for that, and yet we forgot about body diversity. We definitely have forgotten about it. Yeah.
Yeah, and another term I really like to use and bring in is thin privilege, right? It's the
Hmm.
privilege that some people have, and privilege is unearned usually, right? So that's why it's a privilege. It's an unearned privilege. Um, thinner people experience and get to live a life with less sort of noise about their bodies, less feedback about their bodies. Again, to the weight stigma, they don't experience the weight stigma. So when they go to the doctor and say, I have knee pain, they get a cortisone shot
Treatment.
or
Right.
something.
They
They
get
don't get
treatment.
told, come back in 6 months when you've lost some weight. So,
Right. Yeah.
thin privilege, I think, is so important to acknowledge.
Yeah. Yeah.
It shows up everywhere.
I think that's actually a great segue into the perinatal and pregnant population because one of the greatest challenges we have with women who are in larger bodies is sometimes they're actually denied care in infertility clinics. That they are very, and I get it in terms of the medical providers saying like, look, your outcomes will probably result in miscarriage or an incredibly high risk pregnancy, and I don't want to put you into a medically fragile status by helping you get pregnant. At the same time, so they're being told you need to lose 20 pounds, 30 more, 100, whatever it is, get down in weight, and then you may even get pregnant naturally. But if not, you'll be a safer body to produce and produce a pregnancy. I think there's many reasons. If I had a reproductive endocrinologist on here, they would tell me all the reasons why that makes sense medically, and it's also so devastating for families that are for couples that are trying to build their family in that way. I did have a reproductive endocrinology conversation with a wonderful Dr. Rachel Wienerman who talked about PCOS, and I felt so thankful to her where she said, "Look, trying to lose weight on PCOS is like climbing a mountain while somebody's pushing you down." And I was like, "I feel seen, right? Like I just feel like thank you. Like somebody is finally acknowledging that there are certain medical conditions that make that just lose weight, just lose 5 pounds, just lose 10 pounds is so completely out of reach. It's like climbing a mountain while someone's pushing you down." And I think that that's a shift in thinking. But let's talk a bit about that idea of what a pregnancy means. I would start maybe with what does a pregnancy mean for somebody who does struggle with their body as their body begins to change shape and size. What do we know? I know there's really interesting research about almost like anorexia going into a bit of a remission often for women who are pregnant. But let's start from the beginning. A woman who's struggling with her body wants to have a baby. What are some of the things we're hearing about her approach to pregnancy?
Yeah, yeah. Well, as you know, pregnancy is just such a time of immense change, right? So just like identity shifts, relationship dynamics changing, financial commitments kind of, there's just a lot happening. And we know that for people who have complicated relations with food in their body, food becomes oftentimes a source of control, so that they can tolerate change in other areas, or a source of control so that they don't have to deal with or trying to avoid a change in their body when everything else is feeling out of control. So I think people who already have sort of a, a difficult relationship with eating, it's really easily exacerbated during pregnancy. Um, there's a lot of just, it could be the first time someone's engaging with the healthcare system so much, so that can be
Sure.
overwhelming, or it can be after a lifetime of harmful experiences with the healthcare system. Now they have to keep going back to the doctor every other week. So
Mm,
I think it's just a vulnerable time, from a medical perspective and from the relationship with food perspective. And there's particularly, I think, a lot of pressure on women to have quote unquote the perfect pregnancy, to gain just the perfect amount of weight, to have the type of body that only shows a bump. You don't gain weight anywhere else. The models who model maternity wear online are not even pregnant most of the time. They're wearing a
right.
prosthetic, and and,
Right.
and yet these are the images that were shown of pregnant women,
Hmm.
when really
Hmm.
pregnant women look, in so many different ways. So yeah, just to begin saying that there's so much pressure on women to do pregnancy perfectly, to eat the right foods, to gain the right amount of weight so that their baby can experience health when they're born. That's the pressure. That's like the narrative. When really I think that can create so much pressure and so much harm to the woman that we actually start to go sideways.
Hmm. And what about for women who actually have a very complex relationship with food? Like if they, or more than complex, a diagnosis, they
Mhm.
have a history of anorexia or
Oh,
bulimia. Like
yeah.
what are we noticing about them as they progress through pregnancy? And I think we do have to take a moment, and please correct me if I'm incorrect, but like that some women who have had a history of anorexia may actually have lost their menses, like they lost their cycle. And so, some of the risk of having been so ill is whether there is some challenges to their fertility, and we won't know it until they actually try to conceive. But that is definitely one of the risk factors or the threats of somebody who is dealing with anorexia, and losing that healthy, like normalized cycle of periods. So knowing that that's a risk, what are some of the things that women who have eating disorders deal with when knowing that their body's going to gain weight? It's supposed to.
Yeah, it's so scary, for sure. Um, yeah, I think definitely, someone with long-term restriction is at risk of losing their period. And so that's something, if they're hoping that for family planning, that can be sometimes be a motivating factor for recovery,
Mm.
for some women. I think it's really individualized. I've seen women who have become much more motivated in their recovery once they learn they're pregnant. Um, and then and that can be such a wonderful just way for them to connect with the recovery outside of just themselves. They're thinking about their future, they're thinking about their child. Um, and it's somewhat can be exciting. For others, it's a really, really scary experience to be told pretty much no matter what, your body is going to change, and that is expected, and we need
Mm.
it to. Um, and your caloric needs are going to increase, and we're going to have to be a little bit more stringent on, like, sort of your intake. So that is, I think, can be really destabilizing for others. So there's no I wouldn't say there's like one size fits all type of way it plays out, but it's almost always a little bit complicated.
Yeah, yeah. And like I said, at least from the most recent information I've ever seen, not that it's recent, but what I was always taught was that very often the anorexia may go or bulimia may go into remission, or the eating disorder might go into more of like a remission state, and stabilization state during pregnancy. But then afterwards, when they're left with the body that just carried a beautiful baby, the body doesn't feel beautiful. Like they have a very difficult time kind of reorienting to this body that has changed, where they're not gestating a pregnancy, right? Is that what we're still continue to see as far as, research wise, that there is like there could be a really bad relapse after the birth?
Yeah, I don't, I feel like I would love to kind of get some sources like for this particular thing, but I believe yes, actually. So
Mm.
because, um, again, the way change can impact one's relationship with their eating disorder. Postpartum, you're also experiencing just another level of change with much less support often.
Mhm.
And so I think people who have had complex eating disorder histories are very vulnerable again at that point.
Mhm.
And they're also caretaking, and feeling, probably much less resourced to take care of themselves. That goes across the board, probably for most women in postpartum. So,
Mhm.
yeah, I think there's a lot of opportunities to support women postpartum around their relationship with food and body image specifically. I think it gets a little lost in the postpartum conversation. It becomes a lot about the baby. And women are expected to bounce back, quote unquote.
Yeah, the
Back.
bounce back culture. Yeah,
Yes. Yeah,
exactly.
yeah. Yeah, 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 it is.
I'm still bouncing. She's 15, but I'm still bouncing.
Yeah. Yeah.
Yeah.
Yeah, so I think it's difficult to navigate, and I think people are at high risk at that time.
So it's interesting because I'm thinking about this as a perinatal mental health professional, as knowing that I do have therapists that listen to this conversation. Maybe you want to give us some ideas about how to engage in a non-shaming, non-threatening, body positive way about nutrition in postpartum. If especially because I think about it, you're right. There's support that we have in pregnancy. We're seeing our medical teams multiple times, much more frequently. People are actually checking our weight pretty frequently as well, whether we like it or not. But they are checking our weight. They're monitoring us for growth and health, etc. But then postpartum, we get one visit and then there's nobody checking in. And so maybe if I were seeing somebody who's postpartum, whether or not they have a nutritional history, a complex relationship with food that I know of or don't know of, what might be some things I need to do to check in with her? And because I feel like we say, like, tell me about nutrition. Are you eating? What are you eating? How are you eating? And it's more like, I mean, when I can, I eat, but it's not really giving me any real information about her nutritional needs. What might be some things I talk about?
Thanks so much for this question. Yeah, I think maybe a helpful way to phrase it would be, are you finding yourself thinking about food a lot? And what are those thoughts like? Just to open the door that that you'd be open to hearing them talk about some of the ways they're thinking about food. So some people may come in and just say, "Oh, I'm just thinking about grocery shopping," and "Oh, it's so hard to get to the store with a newborn." And others may say, I think the more red flags would be, it's so hard to eat, and then I get really stressed out. I can't figure out what to eat. Um, or once I start eating, I can't stop, and I'm feeling really guilty about that. I have no time to eat until the baby's asleep, and then I find myself getting way too full, and it's freaking me out. Like we want to create a safe space for those types of experiences
Mm,
because they're so common. Um, and I think a lot of people don't know where to put that. Where do they share that, right? And particularly, we almost never get asked at the doctor's office how we feel around food. I'm pregnant
no.
right now, actually. I meant to mention that at the start of our
Oh.
conversation. So I'm expecting my second child in a couple of months, and yeah, I'm always struck. Doctor has never asked me, just are you feeling okay around food or your body changing? Like even just one question would make me feel like, oh, this is a place I could bring this.
Hmm.
And in therapy, often, like maybe historically, if they've never talked about food with their therapist, it can feel kind of awkward to be like,
Sure.
suddenly I have anxiety around eating the right thing or eating the right amount or the right timing. So I think just asking that question, are you finding that you're thinking about food a lot? Can just open the door a little bit. Um,
And
that's
so when I hear that question, I'm like, that's a great question. And what do I say when she says yes? Like, what comes next? Like, as a therapist, I'm not trained in eating, behaviors or eating health or nutrition or things like that. I know a lot, but I'm not trained in it. So,
Mhm.
what are some of the things that might be the follow-up to that? Like, when does this become just a safe space and conversation versus like, I'd love to refer you to someone who is a nutritionist who can guide you, a dietitian who can guide you in kind of supporting you in that space. So is it I need to support her as a therapist and the anxiety around food? Or is this where I need to have a more of a collaborative relationship with a dietitian that can help her make navigate it, like to just help her walk that walk? Where are you thinking about? Like
Yeah.
where that line is?
Yeah, I think the line is like much maybe how do I put maybe sooner than we all think.
Okay.
I think people think referral to a dietitian means it has to be the most serious. It has to be a diagnosed eating disorder. But really, going back to what we were saying at the start, a lot of this gets so normalized that we never know when is the right time to reach out for help. So I think
Yes.
as soon as someone is really expressing like it's just taking up a lot more of my mental space than I'd like, and I think the tools you would offer as a therapist would just be amazing in that just kind of learning how to maybe reframe thoughts or redirect thoughts or to take urgency out of decision making. But at the same time, I think a dietitian is really useful because it's just a place for all of that to go.
Hmm.
And particularly if you can find a dietitian who is specialized in disordered eating specifically, because I think those dietitians are the ones who are really trained to investigate it with some curiosity. It's not just what you're eating, but why, and how do you feel then after you make that food decision, and how can
Yeah.
we make it all a bit easier, feel a bit easier for you? So yeah,
Yeah.
I
Yeah.
would say,
And I feel like one of the things I would think about is if she starts to cry, like if there's distress in what she's sharing with you, like it's so hard for me. I have to bring up, I had a client who would have a very hard time feeding her baby. Now we're talking like once there was food, right? Beyond formula feeding, she was not breastfeeding, but like she had a very difficult time, no diagnosis of eating disorder, very complex presentation. And I think so much of it was like a lot of it was incredibly emotionally driven, like mental health driven. But so many of the things which a lot of her history showed up with her child. So, for example, if her child wanted to eat something off her plate, she couldn't handle it. If her child would want to, if once she would prepare the food for her child, she didn't want to eat the food anymore. She would become very protective around the food that she had, feeling like invaded if he or she would, try to like touch or eat her food. And, you know, I don't have a diagnosis for that other than anxious, but I think that the way that she experiences food and eating, a lot of decision anxiety, like I don't know what to make the child that will eat, that she will eat it, like that kind of thing. It began to really deeply present postpartum, and I definitely can address anxious, but not the food. And it was fascinating to watch her own experience and painful because it was distressing to her. And she didn't feel like a good mom when she was in her head around the food prep. Is that something that you see?
Yeah, oh my gosh, certainly. I think what you're describing here can happen for it, yeah, definitely for people who are mothers and also just like, any other type of person. It's that type of anxiety. It's that type of,
Yeah.
I can't explain why, but I am possessive, or I can't explain why, but I get really upset when something happens with food, or I can't explain why, but so but I think what you're naming here is so interesting as well. Not just the way new types of food relationships can pop up when there's any amount of change, particularly another person in your household that you have to take care of 100% of the time.
Yeah.
Um, yeah, so
And the exhaustion of that, like right, the exhaustion of taking care of your food, but now somebody else's food. And I think that potentially will come up even in breastfeeding as well. Like that, I can this is my responsibility. This is taking time from me. This is maybe what I want to do, but maybe also can have a complex relationship with it, right? I would imagine. It's not something I've seen per se. I've seen it more in like, let's say, for example, like trauma survivors, that would be a complicated space for them to try to exist in terms of using their breasts for nutrition, for if especially if their breasts were part of their historical childhood trauma. But that idea of like I'm in charge of feeding and providing, where do I where do I belong in that story, right?
yeah, right. Where do I begin and end, and where does the child begin and end? And I have heard from other women, I don't want to perpetuate the cycle that I experience. And so there's a lot of pressure, I think, right from the get-go that they want to model a good relationship with food for their child, but don't quite have the tools and the support to know exactly what that looks like because they've never seen one before.
And also may not even realize the relationship they actually have with the food is not healthy or
Yes,
not functional, right?
100%. That
Yeah.
is something that a lot of people live with, not knowing that actually, oh, it doesn't have to be quite this
That
way.
way. Yeah.
Mhm.
And I think that when we bring some awareness to this conversation, these conversations will highlight some of those like abnormal behaviors that are, hey, no, that's not the way everybody thinks, right? Like I remember seeing somebody like, oh, she only eats half a bagel or she scoops out the bagel. Like you can go into certain stores for sure in Brooklyn where you can order a scooped out bagel. Like now as an adult looking back and maybe a healthier person in my mind looking back at that, I'm like, there's something disordered about that. Now, yes, it's probably scooping out half the calories, and so it's not a 450 calorie bagel. But what does that mean that we're scooping out and throwing out half of a product in order to reduce my calorie intake? Like to me, I'm going to see that now through the lens of that's disordered behavior that we're promoting as healthier. But there's something disordered around that. Do you agree?
Yeah, I think, it's obviously can't be black and white, but I do feel like for most people who are engaging in that type of behavior, they're being driven by, yet that external factor of calories versus
Mhm.
what do I really feel like eating today? I mean, I would guess most people who have done that probably desired to eat the full bagel, but felt
Right.
it would be the better thing to do would be to scoop it out. And so I think in my work, it's all about reconnecting people back to their physical desire, and trusting that it's going to be okay. If they desire the full bagel, likely later that day they won't desire a full bagel again.
Mm.
Maybe their body would feel maybe a craving towards something crunchy versus something doughy, or maybe their body would move towards something more protein based versus something more carb rich. So, but we lack a lot of that trust because diet culture keeps saying, just keep scooping out the bagel.
Exactly.
We forget to kind of check in and be like, wait, what do I really want?
Right, absolutely. I think that's one of the things that I hear from people, especially who are taking the GLP-1s, that one of the things that has changed is the food chatter, which I think that people who have it name it and understand it so clearly, and it's so nice to see it named like from a medical perspective. And people who don't have it absolutely do not understand it. Like they have no idea what that means. And I think that that's one of those things where these medications are highlighting some of the unique features for people who do struggle with eating or weight gain or weight management. Like there are other factors here other than motivation and control. There are biological factors that are that are making up choices and making up our perspectives and relationships to food. And I think that that is an add value from a sociocultural perspective. That's one thing that I think these medications are highlighting is some of the change in the brain perspective on food and hunger and that relationship to food. So just I'm hoping to see continued studies around that and more. We do know, by the way, that these GLP-1s are influencing, that have tremendous possibility of influencing things like addiction. There's studies that are coming, that drive, that curiosity, that jonesing. Many people who struggle with food feel similarly. So I'm excited for the future on that. Maybe we could end today with I feel like you've spoken quite a bit to the misconceptions, but some of the misconceptions around postpartum and eating or pregnancy and eating and food that we want to just make sure people know are not true. So what are some of those misconceptions?
Yeah, thanks for making space for that. I think in pregnancy there's a overemphasis on on like very, very specific nutrients and eating perfectly. When I'm counseling somebody who's pregnant, for the most part, I say we need to be eating enough and we need to be eating regularly, meaning probably every few hours. Because there's so much growth happening in the body. And if we're doing those things, most likely those micronutrient needs are getting met. Everyone is counseled to take a prenatal vitamin. If you're able to eat regularly and eat enough food, um, within the variety that you're comfortable with, most people are luckily able to meet their nutritional needs. But instead, I think pregnant women get hounded by just like ads about particular nutrients and specific foods and superfoods, um, that becomes so overwhelming that they can no longer engage with eating in a positive way.
Yeah.
So I like to bring people back to just regularity and adequacy. Um, and particularly for people who are in their first trimester who are having a really hard time eating naturally because of maybe nausea and morning sickness, reassuring them that actually we don't even need extra calories in that first semester, or not first semester, first trimester.
Yeah.
Um, and and whatever they're able to put in their body, even if it's, saltines and electrolyte drinks and bananas, like they'll be okay. There's
That'll
a
be
lot of
fine.
anxiety there that they're
Mm,
harming their pregnancy.
hmm.
But we have to work with the cues that your body's giving you, and we have to keep
Sure.
trusting that your body will keep changing and the cues will keep changing. So I think just moving away from this idea of perfection
Mm.
is really, really important. Um, and then postpartum, I think it's that the body is going to change back to its pre-pregnancy body in any specific amount of time. I think there's a lot of talk about breastfeeding and oh, the relationship between breastfeeding and weight loss or weight maintenance after you give birth. And I just try to make space for that everyone's body is going to respond differently. What we can focus on is the behaviors that make the person feel really good in their body, um, listening to those cues, creating trust, um, learning to embrace change and all of that. But yeah, I
I
think that's
love that.
a big myth for
Yeah.
postpartum.
Can I just ask you, what are some things that you hear women say? I'd love a small tip as to like, what are some things that women can do that help them feel good in their body?
Yeah. Oh, yes. Um, let's see. How would I?
Especially postpartum. Let's think postpartum.
Yeah, yeah. Well, I think a couple of things stand out to me. First and foremost, comfortable clothing.
Mm,
I think there's just a lot to be said for putting your body in clothes that are not giving you negative feedback about your own body. So that has nothing to do with food, but I like to put that out there because a lot of time can be spent in a nutrition session, working on the resistance actually to getting a different size clothing, um, and seeing just how that would change the way they relate to their body and from a sensory experience. So
mm,
I really encourage people to, and maybe it's renting clothing or thrifting clothing if you don't want to make a full investment, but to try and see what it's like to put your body in clothing that's really comfortable. Um, and otherwise, I think it's things that make people feel good in their body are responding to the cues of their body. So, for example, that's like we go to the bathroom when we feel that urge, right? That's a more natural response, but for other people, it's not so natural to eat when they're hungry, and it's not so natural to drink when they're thirsty, or to rest when they're tired, or to stop eating when they're full, for example. So I think hearing those cues and learning really to trust them that we get tons of cues every day, and these are not the only cues we're ever going to get. It's okay to trust and honor and respond to those cues. I think
mm.
that is really what helps people start to get into the place where they feel good in their body.
I
Um,
love that. I
Yeah.
love that.
Yeah.
I think about that also as we close. I think about this from a perspective of how busy our brains are postpartum, and maybe just a moment of quiet to eat. Maybe, somebody's offering, what can I do to help? Just hold the baby so I can eat quietly. Hold the baby so I can sit for a moment and eat intentionally. Take care of this so that I can attend to my body. We talk about this all the time in terms of sleep, but I like your framing it in terms of nutrition. It's more than just like you're supposed to be sitting down when you're eating. It's like, no, if you're quiet and you eat what your body is telling you you want to eat and respond to it in that way, you actually will feel better about your body in that process. I love that. I love that.
Yeah. Yeah. Thanks for summing that up.
Amazing. Eileen, thank you so much. This is a wonderful, wonderful conversation. We will post your information. I guess it sounds like you'll be going out on maternity leave soon enough, but maybe in the meantime, there'll be might be someone out there who wants to reach out. We'll get your info posted into the episode and from the episode notes. Thank you. Thank you. Thank you.
Thanks, Devorah. Thanks so much.